name is Lindsay Barabee, and for this section of my personal reflection journal entry, I will be discussing my interview with Maddie Pearson, who's the Senior Vice President of Brigham and Women's Hospital. So during our interview, Maddie informed us of many of her responsibilities and roles, as well as how she was able to achieve the status that she has in the hospital. In addition to this, she also discussed areas of healthcare that she feels need to be fixed, which were also similar to many of the healthcare issues that we discussed during class. Maddie Pearson is the Senior Vice President at Brigham and Women's Hospital. She is responsible for leading the hospital in strategic planning, capital resource, human resources, and quality and safety in all aspects of nursing. She also coordinates program development and is co-responsible for patient care with the medical officer. Dr. Pearson began her career in medicine as an OB nurse in New York and moved to Boston about 3.5 years ago. Throughout her nursing career, she cultivated interest in evidence-based practice, quality improvement, and safety. Dr. Pearson received her doctorate in these areas as well. She explained during the interview that her proudest accomplishment include getting her doctorate, introducing the daily safety huddle at Brigham and Women's, and the magnet status of nursing leadership that Brigham and Women's Hospital has attained. As we have discussed in class, Dr. Pearson finds that the most pressing issues within the U.S. healthcare system at the moment are cost and resource waste. We have discussed these two topics over the course of the semester. The cost of healthcare in the United States is atrocious, whether it be through insurance costs, co-pays, medications, or the general costs for procedures or routine appointments. A cost reduction tactic that she mentioned was the merge with Brigham and Women's Hospital and Mass General Hospital. She explained to us that through the consolidation of resources, the two entities have been saving a significant amount of money through performing surgeries or procedures at the hospital who does it the most effectively with the best outcomes and the cheapest. Resource waste is another issue that plagues the United States healthcare system. Dr. Pearson explained that unnecessary scans or procedures can significantly increase healthcare costs. She adds that we should learn from other countries to gain a better understanding to promote best healthcare practices, such as countries involved in the NHI or the NHS systems. Dr. Pearson also mentioned that the healthcare often grows from the cost perspective and that the change in evidence-based practice and technology, which we discussed in class as well. Especially since the onset of the COVID-19 pandemic, healthcare administrators have become increasingly reliant on telehealth visits and granting patients access to their test results and appointment reminders through apps and other internet means, which has changed within the past 10 years. I learned a significant amount from Dr. Pearson. Dr. Pearson was an extremely knowledgeable and inspiring speaker. She has worked her way up the ladder in healthcare and gave advice to find an encouraging mentor, find something that we love and are passionate about, and to get comfortable with research and numbers. She also mentioned the need for nurse leaders in higher positions within the hospital because nurses are able to provide a different lens and approach to the management of healthcare, as they see a different perspective from doctors or other healthcare administrators. It was inspiring to see how many avenues nurses can take in their career, especially considering that I will be a nursing student in a future RN within a year or two.